minutes or so.
You're on Mornings with Nadia Mitsopolous.
ABC Radio Perth and WA.
Well, I wonder if you put off going to the doctor because of the cost. And I'm sorry to say that from next week, a standard doctor's appointment will go up $102. Now, this is the third increase this year, and it will now cost $12 more than it did back in March to go to your GP. Now, if you're lucky enough to have a GP who still bulk bills, then you might be feeling okay about this. If you don't, I wonder if going to the doctor and paying $102 up front is getting expensive for you. 1300 222 720. I want to go to Dr. Simon Torvaldsen. He's the chair of the AMA WA Council of General Practice to explain to you why this increase. Good morning, Doctor. Thanks for your time.
Good morning, Nadia. Morning, listeners.
And so this applies just to standard consultations, is that right?
Yeah, the number you quoted is the figure for the Level B consultation, which is the standard sort of 6 minutes to 20 minutes consultation.
Are there any other types of consultations where there'll be an increase as well?
Yes, because the increases are, the increase, in fact, recently announced was a relatively small one. I think the previous fee was $98. It's pushed it over the $100 mark, but the percentages apply to all consultations, so it's all in proportion.
Can you explain why the cost has gone up again? Where are your pressure points?
Essentially, the way this is worked out is not, it's worked out independently by health economists that calculate it for the AMA, and it's a calculation that is based not just on CPI but on labour costs and the other costs of running a practice. And in fact, over the years, the increments have actually been less than CPI on average, and it is not a fee that the AMA is demanding that all doctors should be charging. That's not our role. It is simply an amount that the AMA considers to reflect the reasonable cost of running a quality general practice.
Would you expect?
So you'll find that doctors will charge different fees based on their own costs. So it's not an automatic. Well, it's $102 for everyone.
Can they go over the $102 if they wanted to?
They can. It's the AMA is not a fee-setting body, and in fact, it would be illegal for us to be so. And so you may find that there are some doctors who would charge more, and there will be some doctors who charge less.
Dr. Simon Torvaldsen's my guest this morning. He's with the Australian Medical Association here in WA, their Council of General Practice. He's the chair of that council. The third time, though, this year, is it unusual to have so many increases in 1 year?
It is a little bit unusual, and there was an adjustment actually made earlier this year because the cost of running a general practice had not kept up with the formula that the AMA had used over many years, which applies to all other specialties and radiology and so forth as well. And the general practice is a little different in the sense that our consultations are time-based, and the time spent with patients is gradually increasing, and unfortunately the rebate on Medicare gets less and less as the consultations get longer. So the AMA employed a health economist to look at the actual costs of running a general practice, and they recommended an 8% adjustment earlier in the year. And this was done completely independently of the AMA Council of General Practice. We didn't have anything to do with that calculation. That was set totally independently.
Okay. It is 22 to 9 on ABC Radio Perth and WA. Dr. Simon Torvaldsen, my guest this morning. Will the Medicare rebate rise as well?
The Medicare rebate has risen, and in fairness to the federal government, they did make some adjustments earlier in the year. But one of the problems, Nadia, is that the adjustment has consistently been under inflation. So, for example, when inflation was running at 7%, they adjusted it by 3.5%. And, for example, to take your listeners back to the original conception of Medicare in the 80s, the government took the AMA recommended fee, which was actually at the time the fee that most doctors charged. And they simply said, we will pay you 85% of that fee on the basis that we'll cover all the costs of collecting it, and we call it bulk billing. And the doctors, by and large, accepted that. I mean, it was a perfectly reasonable offer, and mostly we bulk billed because, I mean, none of us like charging gaps, especially when they're not affordable. The problem is that over the years, we've been doing those calculations in terms of what the AMA fee, what the fee is really worth. And as you can see, the amount the government has been paying has been proportionally less and less. For years, they didn't increase it at all. So now we're in the situation where the true cost of the consultation is around $100, but Medicare is willing to rebate only $43. If it had kept pace with inflation, it would have been now around about the $85 mark.
The rebate.
And yes, and therein lies the problem, because government over the years has just simply refused to keep pace with inflation.
And we've spoken a lot about that, and obviously the campaign that doctors have been promoting over the last couple of years to try and get that rebate increase, because my understanding is the latest increase is 20 cents.
Yeah, it's minimal. And the other problem, Nadia, is that in the 1980s, life was relatively simple medically. We didn't have a lot of the technology we've got these days. Nowadays, it might take 20 minutes for me to simply explain to someone the options available to them in terms of health prevention and what to do if after they come out of hospital, after surgery or a heart attack or whatever. And the fee for these longer consultations is proportionally much less. So we're in, unfortunately, the position where the more quality time we spend with people and the better advice we give, either the doctor is out of pocket because we will be charging less, or if we charge proportionally, the patient is out of pocket. So either way, quality care and keeping people out of hospital is actually being actively disincentivized. And I think this is something that we have to change, and the federal government recognises this and makes the noises, but they've yet to commit the actual funds to doing it.
Is there a concern that people might put off going to the doctor as these costs continue to rise?
Yes, there is a concern, and I think that a lot of us will accept that those who can afford to pay a gap, a lot of my patients don't mind paying a gap, but the gaps have to be affordable. And for some people, I think it's getting to the point where it's becoming more difficult to afford. And that's a problem, because often it's those who can least afford it who most need the care. And then there are some people who can't afford gaps at all. And even in practices that are ostensibly all private billing, there's still a significant proportion of bulk billing that happens for our very disadvantaged patients, and doctors have always done this. And it simply means that the practices are not viable. And general practice now works on a profit margin probably of the order of about 5%. I mean, the profit margins, we're all small businesses, are actually very thin. And the danger we face is that if we don't have rebates that keep pace with inflation, we're not actually going to have any GPs, and the alternatives are just so much more difficult and more expensive. You only have to look to places like America, for example, where the costs are multiple times what they are here.
I'll leave it there. Good to talk to you. Appreciate your time.
You're welcome.
Dr. Simon Torvaldsen.